The lack of estrogen or the declining estrogen causes inflammatory responses all throughout our bodies at a cellular level. And then that leads to a pseudo insulin resistance component per se, right? And again, now your body is producing that insulin. It's just your cells aren't recognizing it. So the foods that you eat, things that you normally eat, in the bloodstream, instead of being used to provide energy, are being stored as fat inside around your organs. So that's why it's called visceral fat versus subcutaneous, because it's more dangerous, basically. So imagine your liver and your gallbladder and your stomach and everything just kind of wrapped in little fat molecules. That's what's going on internally. And that's all based on this imbalance, all due to inflammation from lack of estrogen.
Hi, I'm Dr. Avanti Kumar Singh, and this is the Healing Catalyst podcast. I'm a medical doctor with over 20 years of experience and also a lifelong practitioner of Ayurveda. I created the Healing Catalyst podcast because we all deserve a different kind of conversation about health, one that's honest, holistic, and rooted in both science and soul. On this show, I'm joined by the world's leading experts to give you science-backed tools that you can start using today and actually stick with to build real health and longevity. I am so glad you're here. Now let's get to it. Hello, my friends. Welcome back to the Healing Catalyst podcast. Today, we're diving into a conversation that is long overdue and one that I know will resonate deeply with so many of you. What's really going on in our bodies during menopause? And I can't think of a better person to talk about this with than today's guest, Dr. Jila Senemar. Now, first, let me tell you how we met, because I think it really speaks to who she is. I met Jila at a screening of The M Factor, a documentary about midlife women's health. After the film, we were part of a gathering of female physicians who had one of the most empowering discussions that I've ever been part of. Doctors from across specialties, all committed to helping women thrive during midlife and beyond. And as I listened to Dr. Senemar speak with such clarity and compassion and conviction, I remember thinking, I have got to have her on the podcast. Dr. Senemar is so deeply rooted in science, but also brings heart and presence and true partnership to the way that she cares for her patients. Her mission is to walk alongside women through perimenopause and postmenopause with evidence-based support, integrative wisdom, and so much empowerment. And I couldn't be more impressed with her approach. In this conversation, we get into all the things that women need to know about menopause, but were never taught. What perimenopause, menopause, and postmenopause actually mean. Why symptoms like anxiety and brain fog and sleep disruption are often missed or misdiagnosed. The truth about hormone therapy, what we got wrong for years and what we now know. How menopause impacts your long-term health, from your bones and metabolism to your brain and your heart, and how to work with your doctor to make informed choices for your health. She also shares the connection between postpartum depression and perimenopause, the place for GLP-1 medications and hormone therapy in managing weight gain, and why menopause is not the end, but a new chapter of opportunity. But before we get to the episode, let me tell you more about Dr. Senemar. Dr. Jila Senemar is a board-certified obstetrician and gynecologist with over 20 years of clinical experience. She's the founder of Jila MD, a concierge women's health practice in Miami that's focused on perimenopause, postmenopause, hormone therapy, metabolic health, and longevity. She's also the founder of the Miami Menopause Collective and Empower Her Miami, both of which reflect her deep commitment to reimagining care for midlife women. Dr. Jila has taught at the University of Miami and Florida International University, held leadership roles at Jackson Memorial Hospital, and continues to integrate the latest research, including from the North American Menopause Society, into the personalized care that she provides for her patients. She is a fierce advocate for women, a gifted teacher, and a deeply compassionate healer. I am so excited to share this conversation with you. Now let's dive in. Hello, Jila. I am so excited that you're here. Thanks so much for doing this with me today. How are you?
I'm wonderful. Thank you for having me on today.
Absolutely. I'm so excited to have you on for my audience because menopause obviously is kind of having its day right now, but it is such an important topic. And you, as an OB-GYN, you have so much knowledge and experience. And also, you really have an integrative perspective on this, which I think is so important. What I really would love to do on this episode is to really help women understand what perimenopause and menopause are, because I think there is a lot of confusion about what exactly is it, what actually happens to our bodies, what should we be looking for? And so I'm just kind of really excited to dive into this idea of menopause 101 almost, and what every woman really deserves to know, but really wasn't ever taught, including physicians.
I think we're the first ones who will admit to the fact that we were not trained in any of this.
Right.
It was kind of, sprung upon us, I think, because of what was going on in the world back then, in 2002, when the study came out with the Women's Health Initiative, which it had all the best intentions to really look at women's health and see, how they could improve things. And unfortunately, the way things go in terms of studies and, getting the data and interpreting it correctly.
Right.
That didn't happen. As they were in the midst of coming up with the data, the media got a hold of it. And, it's all about making the big announcement and the headlines. And the headline was made, unfortunately, in a poor manner, because basically it set us back 23 years. A whole generation of women were terrified to touch hormones because of that headline that hormone therapy causes breast cancer, stroke, and heart attack, basically.
Right. Right. Yeah. So it wasn't just the patients, it was also the physicians. Like
We
so
were
many
we
of
were
us.
trained to stay away from it. Okay, nobody
Right.
needs to be on this.
Mhm.
Unless they really need it, and if you do, then that's a small subset of people. I mean, I was in training, and literally, it was overnight where we went from one thing to the next, where it was give them hormone therapy, or okay, now we're not going to give it to anybody. We
Right.
don't want anything bad to happen to women, and that's first do no harm. So that was the goal.
Right.
Yes, it's unfortunate they're going through menopause, and that's it and moving on. And again, imagine we're younger, and at that point, menopause is not a thing in our future. So, it's like, it's not in your forefront.
Right.
You're not going to pay attention.
Right.
Go forward now. Here we are in 2022, right after the pandemic, honestly, is kind of when I got into it, was because it was a personal thing, right? And it
Right.
always starts that way, isn't it?
Absolutely. Absolutely.
Like we're struggling and we're like, something's off. I'm not sure what's happening. And you start paying attention
Right.
and you start delving in. And I kept checking blood work and I was like, nope, 1 month I'm fine. The next month my, numbers were elevated. And I was like, that doesn't make any sense. Let me
Right.
check it again. And I was in denial. I was like, it's not
Right.
happening.
Yeah.
And sure enough, I was actually going through perimenopause. I just didn't realize it.
Mhm.
And it wasn't until I needed help that I asked, and I was told, "Remember, we didn't learn about this. I think you're
Right.
just supposed to just kind of go with it and see what happens." And I was like, "I
Right.
don't know. I don't buy that," because my mom was
Yeah.
on HRT
Sure.
back in the 1990s, and I'm not actually the one who took her off because of the study. I was like, "Mom, I know better.
Right.
You need to
Right.
stop."
Yeah.
And so I knew there was a missing piece. And with us, I think women were more intuitive and we listen to our patients. And it's not just about in and out, it's about, okay, what is she telling me? And,
Right.
in obstetrics and gynecology, we have a close relationship with our patients because we see them throughout their whole reproductive life, pretty much, right?
Yeah. Mhm.
And I remember, like, these are women I've delivered all of their babies, and
Right.
now they're in their late 30s, early 40s, and they keep coming with different symptoms. And it just didn't make sense. I was like, there are missing pieces here.
Mhm.
And how is it relating to me? Again, it all was like the perfect storm, basically.
Right.
And it wasn't, it was like 2, 3 in the morning. I'm scrolling and I'm like, there's got to
Yeah.
be something going on. And
Right.
sure enough, once you kind of open up that Pandora's box, it kind
Right.
of blew my mind. Like, where have I been?
Right.
Why have I been like kind of under a rock about this for this long?
Yeah.
And this is wrong. We're doing a disservice to our patients
Right.
by not being there for them in the hardest part. I mean, menarche is not so bad. Like, we know what to do with that.
Sure.
Reproductive years, we're really good at obstetrics. Like, we have that down to a science. Any kind of high risk situation, we're ready for it.
Mm-hmm.
You get to this and it's like, I don't know.
I don't know, right? Let's clear up some of this confusion for people. So I'd love to start with perimenopause, okay? It's very confusing because it's like you said, it's all these symptoms that are sort of non-specific. You're not sure what's happening. So first of all, what exactly is perimenopause? Can you define that and explain that?
I think it's good to start with definitions. That way we know
Yes.
what it is we're actually talking about.
Right. Mhm.
So there's pre-menopause,
Mhm.
which a lot of women confuse. Pre-peri, they think it's the same. I said, no, you're actually, hormones are normal and there are no symptoms and you're having regular cycles. Now moving into the peri stage, there's the early perimenopause, late perimenopause.
Mhm.
Early perimenopause, again, not a lot of fluctuation in the hormone levels. And your periods are still occurring regularly,
Mhm.
pretty close to it, once a month or so. But there are little tweaks to it. Some are heavier, some are lighter. Sometimes
Sure.
they come a few days earlier, a few days later. You notice them, but again, we're not paying attention.
Sure.
Moving into late perimenopause, or the transition we call it, now you're having bigger shifts and changes. The periods can skip for 2-3 months at a time,
Mhm.
then recur. Or I've had patients miss it for up to 11 months, think they're almost there, and then it comes
Wow.
right back again.
Mhm.
Or they get them more frequently, two a month or something to that effect. So there are more cycle irregularities. And some of the levels may start to fluctuate a little bit in terms of the hormone checks.
Mhm.
And there are more symptoms in late perimenopause.
Mhm.
Menopause is one day, literally one day, where it's been 12 months, 365 days of no periods.
Okay.
So that's menopause. Then any day after that is postmenopause
Mhm.
for the rest of our lives. We're in postmenopause. So those are really the differences.
Mhm.
And I think a lot of the symptoms will start usually in that late perimenopause stage and go forward.
Mhm.
In the early one, you don't feel a lot of different things. There are subtleties that if you are very in tune, and women are becoming more in tune to their bodies, I think,
Mhm.
because of everything going on out there.
Right.
All the talks, all the discussions, social media, it's being used in a good manner now. I think it's getting the information to more people globally.
Sure.
And so they know now. They're like, okay, wait, I think I heard somewhere that this burning tongue situation is a symptom. Okay. Then they start to become more alert to what's happening with them. So in perimenopause, you get all the above. It's like not sleeping well. Sometimes you have hot flashes, other times you don't. So again, I want women to stay away from the hot flash and the period situation because a good 80% of women are getting dismissed by their doctors. Well, you
Right.
still have a period and you're not having hot flashes. You're not there
Right.
yet.
Thank you for really clarifying that because I think so many women equate menopause with not having a period and with hot flashes and that's it. And that's all they look for. And so then they think that they're actually like completely losing their minds because they're having all these other symptoms, but they don't even realize that there's something they can do about it because it's related to perimenopause. They just don't understand that. So I think it's really helpful. So let me ask you this, because you mentioned, a burning tongue sort of feeling. What are the early signs and sort of maybe some of the unusual signs that women should be looking for, even if their cycle seems normal, right? So that they're entering sort of that late perimenopause stage.
Right. So, I want them to be attuned to their bodies, right? And what's going on. They don't feel like themselves. A lot of them will say that. And they've been to multiple doctors. Some go to a neurologist because they're having more headaches or their vision is changing or they go to their primary doctor because they have vertigo or like some dizziness that they're not sure, ringing in the ears, tinnitus. These are the off the wall symptoms that a lot of people get that they are not paying attention. So they go to different people, not really realizing maybe I should go to my gynecologist. Maybe there's something else underlying this.
Right.
And to be fair, it's funny when you tell them, well, tell me all your symptoms. And you ask and you get all of these weird little things. And they're like, I'm like, oh, it could be hormonal. And they're like, what do you mean? You're a gynecologist. How does this relate to that?
Right.
But what we need to educate more about is the fact that we as women are, number one, quite complex.
Mm-hmm.
And number two, we have estrogen receptors all over our bodies from the head all the way down to our toes. So yes, can it affect every part? You betcha. And that's why the symptoms are so vast and ever growing, to be honest with you. Like, it used to be 30 something, and now I think we're upwards of 100 because we're just getting more and more different things happening in the body that we need to pay attention to. So the burning tongue, some people even get like cold sores inside their mouth so bad so that like they can't even like eat. Okay. And it just comes out of nowhere, to be honest with you.
Mm-hmm.
It's just one of those things. Hair loss. The change in the quality of your hair all of a sudden starts to shift and change. And you're like, I didn't do anything different. What's going on?
Mm-hmm.
I think the other big one that catches women off guard is the weight.
Mm-hmm.
The weight starts to shift and their body changes, right? It's not, some people even tell me like the number hasn't gone up, but nothing fits. And I don't know how that makes any sense.
Mm-hmm.
And that's because your body is kind of storing fat in different areas that it normally would when you gain weight, right? It's more that visceral internal fat than that, subcutaneous that
Right.
And so things just don't feel right. The gut, oh my gosh, the gut gets affected in the worst way possible. And again, they go to the gastroenterologist, they end up with an endoscopy, a colonoscopy, like the works.
Mm-hmm.
And the most they get out of it, you have H. pylori. Take some of this and you'll be better. And I'm like, I don't think that's really what's going on.
Right.
Because, we all know, eat kale, do this, do that, right? So you do it all in your 30s leading up. So you're healthy. So you know how your body reacts to certain foods.
Mm-hmm.
All of a sudden now in your 40s, you can't. Like you eat a salad with kale and you get bloated looking like you're almost 5 months pregnant.
Mm-hmm.
What just happened?
Right.
What happened to the gut? And again, now we're talking again more terminology, right? Gut microbiome.
Right.
What's going on there? Because we know that's also related to everything else going on in our bodies, right?
Right.
Estrogen affects the gut microbiome.
Right.
Go figure that one out. Okay. So you need to kind of be in tune with your body. These are the silent symptoms, I call them, in perimenopause.
Mm-hmm.
And believe me, they come to me and they tell me all of this. And I'm like, and it's your hormones. And they're like, you're crazy. It isn't. I have my period. I'm 41 years old.
Exactly. Right.
And I'm like, yep. But you know what? It's the easier one to address.
Right.
Why are you looking for an elephant in the room? Why don't you go for go for the easy stuff. Don't go for the weird things. Say, let's address it this way.
Right.
Give me some time. And if you don't feel better, then we'll go. Right. We'll do the rest of the workup. Yeah. But in the meantime, and to be honest, there are a few different disorders that kind of can mimic the stuff that goes on with perimenopause, like because they feel tired all the time, hair's dry, hot flashes. So it could be thyroid disorders.
Sure.
It could be iron deficiency. Mm-hmm. It could be hormones. Those are the top 3 that you cannot miss. Like you need to check. And again, we know the perimenopause stuff may not even show up. Like all your hormones can come back and your hormones are fine. You're not there.
Right.
But you might catch a thyroid. You might catch a Hashimoto's. You might catch iron deficiency anemia, where with a little bit of supplementation and some iron infusions, they feel like a new person.
Yeah.
But it doesn't mean, like, not everybody needs everything all the time, right? But at least do your due diligence and look at the individual as a whole, not as a part, because we're trained.
Yeah.
Okay. Is it gynecologic? Just go to that. Okay. It's not. Moving on.
Right. Right. Well, I think this is so important because I think what you're really saying is that when you start to get into that sort of maybe 30s, 40s, and you're seeing some of these symptoms and things that you've never experienced before, maybe, or they're changing in some way, maybe start with hormones first before you go to the GI doc and to this specialist and that specialist and go like down all these different paths. Let's start with what's most common. I always say this to my friends and family and patients is like, what's most common is most common. Like, let's go look for those things first. Let's not just go straight to the most, rare or most difficult thing that could be out there because we're scared and we just want to jump to that issue. Like, let's go common things, look at that, and then expand from there. But I think so many people just don't do that. So, what is the earliest age that you really have kind of seen women go into perimenopause, sort of this late perimenopause?
Naturally, for natural perimenopause, I mean,
Yes.
I've seen it in late 30s, like 38, 39. But again, that is, premature. It's premature ovarian insufficiency and
Mhm.
premature menopause. And those women are actually at a higher risk of developing
Right.
heart disease, osteoporosis and dementia. So really, they're at the highest risk for that. Therefore, they really need to be addressed appropriately and by someone who is well versed to take care of them.
Right.
Because those poor women, number one, they're just looking around for their period. They don't realize the
Right.
ramifications of what's coming their way. That's one way. And another side of that is, let's say a woman has had prophylactic surgery with, who has a genetic premutation for breast, ovarian, uterine cancer per se. And
Sure.
so they decide to be responsible and they undergo risk reduction surgery. So they do a bilateral mastectomy, they do hysterectomy, oophorectomy.
Mhm.
They're 39 years old and now they were just put into surgical menopause, which is even more
Right.
exaggerated symptoms.
Sure.
And they're left hanging. And it's like, well, we saved your life, but no, you didn't actually,
Right.
because they're going to be worse off in 4 or 5 years. And I think the newer docs are coming around and patients are now advocating for themselves. And they're saying, okay, before we do this, what's my
Right.
hormone therapy plan going forward?
Right. Right. Because it's not just about the cancer, it's what the protective nature of estrogen, of the hormones that you have, right? So you have to take that into consideration. That's really important. And so, you said one thing before when you were sort of defining what early, late perimenopause are, what menopause is, what postmenopause, and you said something which I think is probably quite shocking to a lot of people listening, is that menopause is actually one day. Can you please explain that?
Yeah, it's just a terminology that we use to identify when you make that shift over from peri to post, basically. It's one day, and that's it. So we all hang our hat on, I'm in menopause.
Right.
Technically, you're postmenopausal. Day 366, you're postmenopausal until the day you die, basically. Okay.
Mhm.
So
Mhm.
menopause is just a definition. It's
Right.
more the post and the peri that matters,
Mhm.
honestly. And the
Mhm.
peri is really where I like to focus on because menopause, we got that down now, right? No
Mhm.
period for a year. Okay, you're having symptoms. Let's do this. It's those poor peri women in their 30s and 40s who have no idea what they're dealing with.
Right.
And half of them end up like, I mean, if the thing, the new divorce rate is somewhere upwards of 40 some percent in midlife women.
Wow.
And some of them are being attributed to these hormonal shifts happening, causing relationship strains, and where both partners really don't know what's going on.
Mhm.
And so the husband is like, where's my wife? Where's my partner? This isn't who I married. And she's in her own world just trying to survive. And so
Right.
there's a rift. And then it widens. And
Uh-huh.
these people end up not being well and separating. And where maybe, I'm not saying for everybody, but what
Right.
if there was a hormonal component to it? And had that woman been addressed and her partner been educated to help support her through this, maybe things wouldn't have ended up the way they did.
Mhm. That's such an important point. I mean, it's so interesting because women take so much on, and we often, because of the stories we've been told, the way we've been socialized, we think there's something wrong with us. And so we internalize it and we try to look for every reason that could be causing the problems. And it's always within us, right? We don't understand that there's something else happening biologically that is causing us to feel the way we are feeling, and I think that's really what you're speaking to. It's so incredibly empowering, I hope. To me, hearing you say that, it's very empowering, but I hope that it's empowering to women. And do you have sort of, when you had these women, because you're taking care of them from the time that they're in the reproductive years, delivering their children, and all the way through, is there some practice of, okay, when you hit this age or you are in this stage, that you start asking these questions and really digging in so that women can get guided? Because I think there's still a lot of women who don't know this.
So that's the whole premise of what I'm doing and why I'm kind of shifting my practice away from the obstetric part and just really honing in on this subset of women is
Mhm.
because, like I said, we can handle obstetrics well.
Right.
Like they're well taken care of. There are plenty of providers out there who can do that. There's not enough on this side of the equation for what's happening to us going forward. And listen, this is, we're in our 40s when this is happening. Life expectancy has improved and increased to
Right.
70s, 80s, maybe 90s. Okay, that's the second half of our life. How are we
Yeah.
going to live that?
Mhm.
And how is it that we're not ready to, or we're not prepared well enough to guide our patients on that journey?
Right.
That's why I'm like, okay, no, this is where it's at for me. And
Mhm.
this is what needs to happen. And I need to be there for them and kind of guide them on this path.
Sure.
So I have actually taken it upon myself. Like I said, they come in for their well woman exams. They don't really know what they're in for. And normally it's an exam. You do your pap smear and, do some blood
Mhm.
work and you're out of there.
Right.
Well, that 15-minute has now turned into an hour visit because I'm not just going to let them walk out the door.
Wow.
I'm going to ask. I'm going to ask all of these questions. And even if they say no, 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 now I've already alerted them to what to
Yes.
look for.
Yes.
So
Right.
we've had the discussion.
Mhm.
They know. And so they go out there armed, actually, with like, okay,
Mhm.
well, I'm not there, but I'll know when I am.
Right.
And that's it. That's
Yeah.
like the goal for me as a
Mhm.
practitioner is to
Mhm.
arm them with the information.
Right. I think that's so important. And so could you also, I mean, that's hugely important because, again, by asking the questions, what you're doing is you're raising someone's awareness to actually look out for those things, right? And to not just blow it off and be like, "Oh yeah, I'm having a burning tongue," or, "I'm having some pain here," or whatever it is, or "I'm having mood changes," and not maybe putting it together that it could be a hormonal issue going on for them, right? So I think that that's so important.
Women in general, right? We do so much. We multitask everything, right? We take
Right.
it upon ourselves. So, and typically we're able to juggle quite a few things, work,
Mhm.
kids, husband,
Right.
chauffeuring people around. We can do it all.
Mhm.
And that's when we don't pay attention. And that's where it's, we're falling short. It's all this whole notion of self-care. There's a reason for that is because if we're not taking care of ourselves, we need to be selfish. We need to take care of us so we can take care of everybody else well.
Mhm.
If
Mhm.
we're not doing that, we're going to fall apart eventually. And
Right.
I've seen it time and time again. And like I said, I have a relationship with my patients. I've seen them through quite a few things.
Mhm.
And when they come in, and they've lost it. I know where they're at. And I look at
Right.
them and I said, this is what's going on. And
Mhm.
but my doctor said I need anti-anxiety and I'm depressed. I said, you're not depressed and you
Mhm.
don't have anxiety. It's only being exaggerated because of your hormonal changes right now.
Right.
Let me help you this way. So rather than give them 10 different antidepressants and anxiolytics and a
Mhm.
sleeping pill to top it off, I'm like,
Mhm.
can we hold off on that? Let's
Yeah.
try this and let's
Uh-huh.
see. And they come back and they're like, how did you know?
Right.
It's so frustrating to see this, on a day-to-day basis. I'm like, I am not a rocket scientist. This is not that
Right.
difficult.
Right.
This is just part of our armamentarium. This is what we do. This is what we should
Mhm.
know how to do.
Mhm.
And to put women on all of these other medications that they don't necessarily need. Not everybody is the same, right? It's
Right. Of course.
individualized. Some
Sure.
people may need a little help with this or that. And then you add the hormones and then you balance everything out.
Right.
But majority of them don't need it.
Right. And so could you explain for any of the listeners who are a little confused of like what actually happens when you are going into perimenopause? What are the hormonal changes that are happening?
So the three most common hormones that we're talking about, estrogen, progesterone, testosterone.
Mhm.
That's what we're discussing. And again, we thrive on all of them Estrogen is like our happy hormone, right? It gives us our mood and, just vibrancy. Progesterone is like our chill pill. It kind of calms us down, kind of keeps us even keel, and it helps with sleep and calming down the brain at night. Testosterone is obviously for spunk, basically, is what I call it. It gives you a pep in your step and, for libido, muscle mass maintenance, things like that.
Sure.
We have all of those in our bodies. And as we go through this shift and change, they start to vary in how much the ovary is producing. So it doesn't just drop off overnight.
Right.
1 month you have more of estrogen, the next month you have less. And so that's where the variability comes into play. That's why we call it the zone of chaos, is what it's been coined as, is because instead of having this regular amount of hormones in your system at all times, you're getting highs and lows. And those highs and lows, those fluctuations are really what's kind of throwing your system for a loop. Like it doesn't know what to do. Your body's like, are we happy or are we sad? I don't know. So let's be sad. Let's be depressed. Let's be isolated and not want to socialize with anyone.
Right.
And so it's that fluctuation of estrogen and progesterone. And testosterone is just kind of like lingering around. It's like, do I go? Do I not? I don't know what's happening here. And then as we ease into menopause, then that estrogen is what declines the most and the fastest. Then progesterone, and testosterone is actually last to go down. So you still have a little bit being produced by the ovary, and in menopause, it kind of goes away as well.
Right.
So when we're replacing, you really want to, I don't like to hit everyone with everything. Each one of us, I think, has a little different finesse to how we do it. And I think it's individualized based on the patient and what their quality of life looks like when they walk in and fill out that questionnaire. And some will need all at the same time, and others will need a little bit of like kind of layering it on as we go. I tend to see them quite often at the beginning because it's hand-holding. It's really calming them, not letting them understand what's happening, what are we doing, why are we doing it. And that way, if they have symptoms or little side effects, then we kind of ease them through it so they don't just stop it and be like, it didn't work. No, you got to give it time. It's just like everything else.
Right. Okay, so we'll get back to that. I have a question about that, but I want to come back to it. I want to first go to menopause because, hot flashes, they get all the attention, right? Everybody knows about hot flashes. We all talk about it. And if we don't have hot flashes, we don't think we're, getting closer to perimenopause, menopause, or not having bad menopause. That's sort of the discussion that happens a lot. So what are some other symptoms, maybe 2 or 3 surprising symptoms that you have seen that most women don't realize are definitely hormone related and this, sort of menopause shift?
I think a lot of the mental health components to this are not realized by women. So women with a history of postpartum depression or who have any kind of anxiety disorder underlying or ADHD, and these women are at a higher risk of worsening of symptoms as they're going through this transition. And they're not realizing it. They're on their ADHD meds. They do great. And all of a sudden, they're like, I still can't focus. Something's wrong. I can't understand what's going on. I think my medication's not working. No, it's not that the medication's not working. It's that now your body is on overdrive. And so your ADHD is on overdrive as well. So I think a lot of those are something we need to really be cognizant of and like pay attention to. I think the other one is the brain fog, the memory. They honestly go to a neurologist thinking they have Alzheimer's dementia kicking in.
Right.
And they're like, nope, I know it. I left my keys. I don't know where I put all that paperwork. Some of them have told me, I feel guilty, but like I left my kids in aftercare. I forgot about them. And then they're like, oh my God, they knew something was off. And then they went and got the kids. So it's little things like that that we need to really tune into and be like, okay, these are all components of what's going on. And you're not falling apart. You're not crazy. This is norm. Every woman is going to go through menopause and this transition.
Right.
And each one of us is going to have a different journey. Some will tell me it wasn't that bad. I don't know what all the hype is about. And I'm like, well, you're lucky. That's all I got to say. You're one of the lucky ones who didn't have to struggle. So enjoy that. But majority of women are going to have a lot of the symptoms.
Mm-hmm.
I think that more is like the dry eyes, the dry skin,
Yep.
itchiness of the skin, where they're like, I just want to like rip off my skin. I don't know what's wrong with me.
Mm-hmm.
And that dryness can even relate to like the genital areas, like the dry,
Right.
atrophy,
Mm-hmm.
itching, and or recurrent urinary tract infections, or recurrent vaginal infections. And they're like, I've never had one in my life.
Mm-hmm.
And now all of a sudden I get them back to back to back. I've been on antibiotics for the past 3 months per se.
Right.
Again, things that we need to really pay attention to and understand, because it's like, okay, what is not adding up?
Right. And you know what's so interesting, Jila, is that all of these symptoms that you're describing from an Ayurvedic standpoint, it is all an increase, an accumulation of fire, which is what we have a lot of in that midlife time, to do all of these different roles and responsibilities, whether it's having children, caretaking for elderly, having a job outside of the home, inside the home, all of these things that we do, we need a lot of fire to do that. And everything that you've described is a result of having too much fire. And the way that we look at it, that I look at it anyway, from an Ayurvedic standpoint, is that however much you were able to balance that fire out in that middle time of your life, that will determine what kind of symptoms you have. And so there's that fluctuation of some people have hot flashes, some people have mood issues, some people have nothing, right? It's all based on how well you were able to balance it in those mid years of your life. And so it'll just show up differently. So it's so interesting to me because, again, I am always so amazed that Ayurveda shows up everywhere and even in this.
Right. Yeah. But again, you can tell because some women who are really in tune,
Right.
they'll figure it out that way. They'll be like, you know what? I knew something was off because of this and this and this. And they can actually, with a lot of the practices, and they can
Sure.
actually help themselves
Exactly.
through quite a portion of this. And I think that is where it's at. That's why it's not a
Mhm.
one size fits all situation here at
Right.
all.
Right.
People are like,
Right.
are you just going to give hormones to everybody? No. We start with the basics.
Mhm.
Okay. And then we work through to where they need to get to. And some people may never get onto hormones. We may be able to manage them. And again, each person's body's different.
Sure.
And so
Sure.
we just, you just kind of have to have everything available for them to see
Right.
what's going to work.
Right, exactly. So another question that I know a lot of people have is, and you kind of alluded to this earlier, is what's really happening with the metabolic changes that, where we start gaining weight, our bodies start to shift, things that we used to do to maintain our weight, or, we're exercising all the time. We're doing all these things that are good for us, and everything's just changing. And it's very frustrating for so many women because, again, this is a big shift and there's so many changes that are happening, not only in your body, but in your life many times. And it can be very distressing for so many people because you add that on to everything else that's going on, whether it is that you're becoming an empty nester or now you're caregiving or you're changing your career, whatever it is, it can be really stressful. So what's going on metabolically during this time that makes weight gain so common?
So I think what happens is with women, this whole estrogen component, right?
Right.
When you don't have enough of it and it's fluctuating and, some days it's more and other days it's less, it causes an inflammatory reaction internally. And that's why cortisol is trying to calm your system down. All of these things are really, we're trying to get to the root cause of what's going on.
Mhm.
And we're trying to calm down that inflammation. So the lack of estrogen, or the declining estrogen, causes inflammatory responses all throughout our bodies at a cellular level. And then that leads to a pseudo insulin resistance component per se, right? And again, now your body is producing that insulin. It's just your cells aren't recognizing it. So the foods that you eat, things that you normally eat, in the bloodstream, instead of being used to provide energy, are being stored as fat inside around your organs. So that's why it's called visceral fat versus subcutaneous, because it's more dangerous basically. So imagine your liver and your gallbladder and your stomach and everything just kind of wrapped in little fat molecules. That's
Right.
what's going on internally. And that's all based on this imbalance, all due to inflammation from lack of estrogen. So
Mhm.
I always tell patients, it is not a one-sided equation when we're treating all of these perimenopausal symptoms. So hormones aren't going to be the end all be all. People think, so if I go on hormones, am I going to lose weight? No, it doesn't work that way.
Right.
We're just balancing your hormones out with the hormone side of it. Sometimes when you do that, then that internal inflammation kind of calms down and your system starts to rework again. Other times it doesn't. And so you have to use other methodology to get into that next phase, kind of reset your system and then move forward. Okay. So this weight gain is different than what we had when you would go on vacation, gain 5-10 pounds, come home, monitor what you were eating, do a little extra cardio and you'd lose it. It doesn't work like that. And that's the problem women are having with this weight component of it is they're banging their head against the wall. They're like, okay, I'm just going to starve myself, basically. I want a 500-calorie diet and I'm going to go crazy with the cardio. All that's doing is raising those inflammatory markers. And guess what? The weight keeps going up and up and up. And they're like, I don't know what else to do. And they're frustrated. Like they are beside themselves because women, at the end of the day, it's all about how we look and how we feel. And that all plays into it when you feel fluffy and your clothes don't fit right and you look at yourself and you don't look like yourself. Like they look puffy. They look inflamed.
Yeah, exactly. So what's the way to handle this? Like, what do you suggest to your patients?
So I like starting everything from the base up, right? Like, it's all about nutritional components. It's all about exercise regimen. And that has to be tweaked completely because I have to tell you, 9 out of 10 women don't have it right. And it's not their fault. We weren't really taught. Again, here I am a gynecologist. I'm a nutritionist and exercise physiologist now, right? You need to pick this stuff up. That's why I always say this is not just, I have to be holistic. I have to look at the whole overall woman or else I'm not doing them any service. You can't just hand out hormones and be like, be on your way. I fixed something, but I didn't fix the whole overall problem. Like we still have more work to do. So we need to really delve into that. And honestly, a lot of diet modifications will help with that inflammation. There are certain foods that if you add will help bring everything down and you feel fuller, you feel better. And it's kind of like, oh, wait, I didn't realize I could do that with food because again, the gut microbiome is offset too. So you have to fix that. And then the exercise component of it, it's a crapshoot for everybody. You need some cardio, but you need weights, you need resistance, you need muscle building activities. Otherwise, we're going to have muscle loss and then you're going to have bone loss on top of it. And then you need the protein and you need this. And so it's like, there's always this thing on social media where you see it's like, it's a full-time job to keep up in midlife. Like, did I eat my protein? Did I get all my supplements? And did I get all my water and creatine? And again, there is a reason, there's a method to the madness, basically. And we need to make sure women understand that and chip away at it. Is it going to be overnight? No, but it's a steady climb, but you will get to the other side of it.
Yeah. I want to ask, what's your opinion of these GLP-1 agonists? Like, how does that fit in for your patients that are like this?
So again, that's another part of like obesity medicine now, right? That I have to delve into. And I'm like, okay, I guess I'm going to get that certification. It keeps we're always learning. And I think if you find a practitioner who's always learning and evolving, you're good. If the ones that are like, no, I'm done learning. Yeah, you know what? We're done with that too. We need to move on. I'm always going to be an eternal student, because there's always something else coming up. So there is a place for them. I have to say, there is a place for them if done appropriately, correctly. The most recent study that was just published was on that and HRT. So they took women who were in midlife, who needed to lose weight with hormones and GLP-1s and with only GLP-1s. And the women on HRT plus GLP-1s lost 30% more. So the proof is in the research.
Exactly.
And again, what I explain to patients is this is not a Band-Aid situation. This is like, well, what if I come off it and I bounce back? I said, this is not that situation. Okay. This is a different methodology to it. There's a reason for this insulin resistance. We know what it is, and we know how your body is going to be metabolizing this peptide, basically. You're just giving it a boost to kind of fix that internal switch and make it work. And so later, and again, the weight gain that we're talking about is somewhere between 5 to 15 pounds. It creeps up on them within like a year or two. So we're not talking the women who need to lose extra amount. So wait, that's
Sure.
not the situation. This is like the 10 to 15 pounds that they gain in this midlife shift. And once they're able to get back down to where they need to be, they can, again, I've spoken to endocrinologists and they're like, well, it's kind of like any other medication. If you feel good on it, why would you come off of it? Okay. Or they're like, then you just kind of wean off. Now you've reset your system.
Exactly.
And you know what? You're not going to need it anymore and you're not going to gain the weight back. And that's what I have seen in practice. So everything that we do is research backed, number one. And number two, I see it on a daily basis. And, they're like, oh, but somebody got pancreatitis and the other one got this. And yeah, everything can be abused. And if you abuse it and you're not going to the right place and you're getting it at a med spa, then I'm sorry. I don't know what they gave you.
Right. Exactly. I think that's a really important point is you have to go to somebody who's really trained and understands how everything interacts, but also, what to look for, how long to be on it, and how to tweak your dose of both your hormones and, a GLP-1 agonist. So there's a lot of complexity and you can't just go anywhere for that. So I agree. So, I want to talk about this midlife sort of wake up call that happens for so many of us in our 40s and 50s. And we start thinking about our next phase of life and longevity. I just wrote a book on longevity. How does menopause affect our longevity as women? What are some of the things that we really need to be thinking about as we move into that phase of life?
It's interesting that this, I think I read somewhere, longevity is a term of 2025. And I can understand why, because we're all talking about it, longevity, age management, whatever name you want to give it.
Sure.
And it is so fun to kind of be in this realm right now because always I have considered myself an obstetrician and women's primary healthcare provider, gynecologist. Because why? Women are typically healthy. Pregnant women are pretty much healthy. We don't have a lot of issues going on. And in midlife, they're still healthy. It's not until after this menopause, this estrogen drop that kind of things go haywire with us.
Right.
And so if I can avoid that, then technically we're helping their longevity going forward. So how do you do that? It's the heart disease, it's the osteoporosis, and it's the dementia components. Like you need to be able to minimize all of those risks well before they're even coming up or creeping up on them. And if you can do that, we're building in their longevity now. How do you want to be in that nursing home? What kind of shape do you want to be in? And what kind of quality of life do you want to have is really what's at the root of what we're doing with hormones and GLP-1s and whatever else have you, because everything we do is about minimizing your risk for developing diabetes, which then we know can cause heart disease, which then can lead to heart attacks and things like that. So the goal is to improve longevity by just being preventative. We want to be preventative, not reactive. We don't want you to get sick and then be like, now you need a blood pressure medication and you need a cholesterol medication and you need this and that. We're trying to avoid all of that. And if you can catch them in their 40s and kind of guide them gently, because guess what? Every single 40-year-old I see when they do their labs, their LDL's already popping up. Do I need a statin? No, you don't need a statin. You need to calm down. We're going to manage your diet. And then we're going to maybe add a little hormone. And then I'm going to recheck it in 6 to 8 months and see where we're at. Because guess what? Most of the time it comes down because that is, again, another hallmark of perimenopause is LDL. All of a sudden, you never had a cholesterol problem and now you do.
Right.
So that's the goal of where we go with longevity is honestly prevention of disease, not rather than treatment.
Right. Okay. I love that. I also put out some calls for questions from my listeners, and some of these came up quite a few times. So a few people asked, is there a connection between menopause and autoimmune flare-ups? Because they've noticed that as they've gotten into their 40s, they've had more of that. What would you say to that?
Absolutely. So there is a correlation because, again, it's that chaotic hormone shift that can throw off any underlying disease. So especially autoimmune. And a lot of people with those, they'll be like, oh, I'm not, they were in remission. Now all of a sudden they're not anymore. Right. And I work with a lot of rheumatologists in the community who understand these fluctuations. And as soon as we kind of regulate them on hormones, everything goes back down. So they go back into remission. And then once they're in menopause full and they're already on their hormone therapy, they really rarely have flare-ups. It actually
Right.
improves it going forward. So
Mhm.
yes, it definitely does,
Yeah.
it can get worse before it gets better.
Yeah. The next question was about the gut microbiome and the bloating and food sensitivities, but you already talked about that. Like, really, it does affect your microbiome and
It is
mhm,
so not understood or discussed. And it's just
mhm,
like, doing some minor modifications to your diet.
right.
Dr. Amy Shaw goes into this.
Yes.
I've spoken to her multiple times about this, and
Mhm.
it's such an easy fix
It
that
is.
you just need to tweak a few things, add a few things in throughout the
Mhm.
day, and your body actually improves within a few months.
Yeah. Yeah. I mean, food is it's one of the simplest things to use for so many things, but it is so difficult in the world that we live in because of how food is made and processed and the tastes and all this stuff. I always tell people don't feel bad because it is a little bit of an uphill battle, but once you get through that, sort of difficult phase of a few weeks, you're golden. The other question that I got, the third question was about sleep and circadian rhythm. And, a lot of women are saying that they're waking up every night, and it's not necessarily like hot flashes. They're just waking up. They used to be good sleepers. How is that? Is that related to the menopausal changes?
100%. It's again the estrogen fluctuation, right? And some people it can cause the hot flashes, which are, throughout the day they just get like sweats, and at night it's like night sweats where they wake up soaked and they have to change their clothes.
Uh-huh.
Others, they have none of that, but they
Right.
literally have this alarm clock in their head that goes off at like 2 a.m. or
Right.
3 a.m. And it's
Yeah.
your circadian rhythm is completely messed up with this fluctuation of
Right.
everything. And
Right.
again, there are actually sleep doctors now specializing in just this, and they will give you like therapies and modalities to work with
Mhm.
to kind of help yourself fall back asleep
Mhm.
safely without medication,
Mhm.
some supplementation with magnesium, the right magnesium, things like that. And you can actually get a full night's sleep.
Exactly. What are some of the other modalities, besides the food and the supplements and the hormones that you really like to prescribe to your patients? Some of the other mind body practices, et cetera. What are some of your favorites that you really find help women who are going through this change?
It's funny. I've always been like right brain, left brain, black and white.
Mhm.
And
Yeah.
I've evolved so much over the past 5, 6 years. But journaling, it really helps. I never really believed in it. I was like, yeah, okay, it's great. Yeah, or, do
Mhm.
this and do. I'm like, no, no, no. It actually does help you get everything down and out of your head so you're not overthinking things. And
Mhm.
it actually helps set the stage for what am I going to do about all of this. So I think journaling is one thing I recommend to all of my patients.
Mhm.
And another one is just having an open conversation with your partner, I think, so they
Mhm.
know what am I dealing with because they're left in the dark and women want to hide everything. They're like, I'm not going through this. I'm okay. Everything's okay. But it isn't. And if your partner knows what you're coping with, then they're going to be more understanding and maybe they can support you better.
Right.
And then you're going to do better going forward. So it's more using a community of supportive things to help yourself up. That way you can do the nutritional component and you
Right.
can do the exercise. Otherwise, you know what? You're running on empty.
Right.
You and I both know to make that nutritional meal is more work. It's a,
Yes.
a lot more work than calling Uber Eats and getting something delivered.
Right.
And if you're not in the mood and you're just like spent, you're not going to do it. And if you don't, then you're not going to get the benefits of the nutrition that we've been talking about.
Right, and if you have that conversation with your partner, with your family, people can go grocery shopping, help you prep. They can support you in what you're trying to do to help yourself feel better, so I think that's so important. I think that you have just provided so much information. I have so many other questions, but we've already been talking for an hour, so we're gonna do a second part. I would love to end with a couple of things that I always like to do on this podcast, which is a connection round. It's sort of similar to a lightning round. But it's really about connection because as you said, I think connection is so key for so many of the health issues that we're going through. And I think it's the whole point of why we're here and why you and I are in the profession that we're in. So I would love to ask you a couple questions. What is something that brings you instant joy?
Ooh, that's a big one. I have a lot of answers for that one. I think instant joy is my kids. my kids and my family, just because we're a small knit family, and seeing my kids growing up into people and like young adults, it's really fulfilling for me because, I'm from a Middle Eastern background where it was just certain things were not said. You know what I'm saying? It was like,
Oh, yeah, I know.
it's like,
Yep.
and my dad never said, "I'm proud of you," like, because it was like, well, it's understood. You know what I'm saying? Like,
Yeah.
my mom was very loving, but like, I built up these defenses. But now to see my kids growing up into like productive members of society, I'm like, okay, I did it right. I did it right. So I think they're my one thing.
Yeah, I love that. Yeah, I have such a similar experience. It's the cultures that we come from. So it's sort of rewriting the script and doing parenting differently. I would agree with you. What song makes you feel most alive and why?
I have a lot. Well, I love Tina Turner because you know what? She was just like in my book, like she was a
I
badass,
mean,
like
yeah.
and her whole story and everything. And her one song that I have on repeat in my car, and sometimes I just need like like an anthem for the day.
Yeah.
It's Simply the Best.
Ah, love it.
I just
That's a
put
good
it
one.
on and like it just gets me
Yeah.
fired up for the day. It's one of
Yeah.
those songs, I
Love
think,
it.
empowering songs.
Love it. And so, really my last question is that, we have talked about so many things and, many of the things we talked about are not easy, right? They're simple and it's about becoming aware, but they're not easy, right? So what's one simple thing that our listeners could try doing today to really support this midlife hormonal shift that they might be going through from perimenopause to menopause, postmenopause? What would you say to that?
I want them to know they're not alone and they got to give themselves grace for this. This
Mm,
isn't their fault. They didn't do anything. This is just a normal part of their body shifting and evolving into another version.
mhm,
We're like kind of being redefined as women.
mhm.
We're developing and evolving into different women than we were. Like what I was 5 years ago is totally different than what I am today. I would never be on a podcast. I would never be on social media. I would never be listening, like talking so much. This is craziness. This is not me.
Right.
And people who've known me, and there's some who stayed with me, and others who are like, that's a little too much for me.
Yeah.
And that's okay. It's that evolution. So we're not done, women. Like, ladies, we're not. We have so much more to give. And I want them to give themselves that grace and understanding. Say, okay, you know what? I was a little nutso today and I yelled at everybody. I'm going to do better the next day.
Right.
And it's going to get better because it does. There
Yeah.
is light at the end of that tunnel. And on that side of it, it's actually better, I think, in my opinion.
Oh, I agree 100% with you. Jila, thank you so much for being on the podcast. I have loved talking to you. I have so many more questions. Would you please come back and we could talk more about
Of course. I
hormones
love
and
this. This was
there's
amazing.
yeah, there's so many topics, so many things that women really need to learn about and understand. And I think your approach is so approachable. It's going to help so many people. So thank you for doing this.
Thank you for having me.
I have to say, this conversation with Dr. Senemar was such a powerful reminder of how important it is for us to really understand what's happening in our bodies. I hear from women all the time in my workshops and emails and DMs on social media, and honestly, in my everyday conversations with my own friends who feel so overwhelmed by what they're going through during perimenopause and postmenopause. There's so much confusion, especially around hormone therapy, and so many mixed messages out there. And that's exactly why I wanted to have Dr. Senemar on the podcast. She is such a gift for taking something as complex and nuanced as hormonal therapy and hormonal shifts and help to make it make sense. The way that she explained the connection between our hormones and symptoms like anxiety, brain fog, mood swings, it was so validating and so empowering. And her breakdown of weight gain in midlife, that's something that so many women are struggling with. And I loved how she gave both the science and the reassurance that it's not your fault, it's your biology, and there is something you can do about it. These are the kinds of conversations that I am deeply committed to bringing to this podcast because this is what women actually need to know. This is the education that so many of us never received. And it's time that we start talking about it openly, honestly, and with compassion. So if this episode resonated with you or helped you feel a little more seen, a little less alone, please share it with someone who might need to hear it too. And if you have questions or topics you'd like us to explore in this series on women's health, reach out and let me know. I am listening. As always, thank you for being here with me. And remember, healing isn't just possible, it's in your power. I'll see you next time. Until then, be well. Thank you for listening to The Healing Catalyst. If you found this episode helpful, please hit follow and share it with a friend. And if you feel inspired, please rate and review because it helps others find this podcast more easily. For more insights and tips, head to my website at avantikumarsingh.com. And to connect with me directly, find me on Instagram at Avanti Kumar Singh. I loved sharing this episode with you. My hope is that you heard something today that sparks a catalyst in your healing journey and helps you build lasting health. Be well, and I'll see you next time. This is a Dante 32 production.